Brought to you by GTA. We start with you.
Bill 111 would add one more measure of protection for victims of sexual assault despite the perpetrator being convicted, explains sponsor Senator Amanda Shelton.
And Bill 111 offers to provide more protections for victims and more information for our community to stop the spread of such diseases.
The bill would require medical examinations of those charged with criminal sexual conduct or abuse at the request of victims. In addition, the bill calls for the training of 6 more nurses in forensic sexual assault examinations. This training would be funded under a some $900,000 grant that the governor's community outreach and federal program offices are in receipt of. Although, according to Shelton, there is a condition of this grant that Guam still needs to meet.
Recipients of this grant are to receive funding on a fiscal year basis for 3 years. Each year, they would have to set aside 5% of the funding if no law is passed that requires HIV testing of defendants charged with CSC at the victim's request.
If the measure is passed and made into law prior to the end of this fiscal year by September 30th, then grant recipients can avail the entire funding for the year. And according to Shelton, 11 states and territories, including Guam, only performed STD testing if the perpetrator is convicted. Although there are concerns stemming from this data that was presented, as Public Health testified not in support of the bill's intent. DPHSS Charlene San Nicolas.
Though early diagnosis is an important tool for immediate planning and treatment of the victim, the alleged perpetrator has not been convicted yet and may violate the rights of the person, which may result in more profound legal issue.
San Nicolas presented more issues with the measure, ultimately stating that it needs to be further explored. And during the measure's public hearing, there was hard data presented. Shelton cited an FBI unified crime report showing that Guam has the second highest rate of sexual assault in the nation, and 75% of the criminal sexual conduct cases reported to the Guam Police Department involve victims who are minors in 2020. Additionally, Shelton stated that data from the Office of Epidemiology and Research at DPHSS shows that cases and incidence rates of STDs have greatly increased in Guam since 2014.
Cases of gonorrhea continue to rise from 99 cases in 2014 to 225 cases in 2018, a 127% increase. In addition, the incidence rate of new chlamydia cases in 2017 was 675.5% per 100,000 population, which was higher than the United States rate of 524.6 per 100,000.
In 2018, the CDC reported Guam's HIV rate of infection at 4.2 per 100,000 population and a 5.0 incidence rate for HIV, which is much higher than our neighboring islands of the CNMI and Hawaii. In support of Bill 111 and also providing testimony was the Bureau of Women's Affairs and Governor's Community Outreach Federal Program Office Director, Jane Flores, Guam Police Department Chief Steve Ignacio, mother of a victim, Kendra Oliveros, and public defender, social worker, Rosalind Regis. Reporting for Guam's News Network, I'm Adriana Cotero.
It's the first new social worker here on Public Defenders